Mental health encompasses a broad range of emotional, psychological, and behavioral aspects that impact an individual's overall well-being. It involves the ability to cope with life's challenges, maintain healthy relationships, and experience a sense of fulfillment and purpose. Mental health is not merely the absence of mental illness, but a state of equilibrium in which an individual can realize their potential, cope with normal stresses, and contribute to their community. 1. Depression. Depression is a prevalent mental health condition characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities once enjoyed. It can manifest in various forms, ranging from mild to severe, and can significantly impair an individual's daily functioning. Example: Sarah, a 28-year-old graphic designer, has been struggling with depression for the past few months. She finds it increasingly difficult to concentrate on her work, and even the simplest tasks seem overwhelming. Sarah has lost interest in her hobbies, such as painting and hiking, which once brought her joy. She often feels exhausted, even after a full night's sleep, and experiences feelings of worthlessness and guilt. 2. Anxiety disorders. Anxiety disorders are a group of mental health conditions characterized by excessive and persistent worry, fear, and apprehension. These disorders can manifest in various forms, including generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. Example: Mark, a 35-year-old accountant, struggles with generalized anxiety disorder. He finds himself constantly worrying about work, health, and finances, even when there is no immediate cause for concern. Mark experiences physical symptoms such as muscle tension, restlessness, and difficulty sleeping. His anxiety often interferes with his ability to concentrate and make decisions, impacting his work performance. 3. Bipolar disorder. Bipolar disorder is a mental health condition characterized by extreme mood swings, ranging from periods of elevated mood, mania, to periods of depression. During manic episodes, individuals may experience heightened energy, impulsivity, and reduced need for sleep, while depressive episodes are marked by sadness, fatigue, and loss of interest. Example: Emily, a 42-year-old artist, has been diagnosed with bipolar disorder. During her manic episodes, she experiences bursts of creativity and energy, often working on multiple projects simultaneously without feeling the need for rest. However, these periods are followed by depressive episodes where she struggles to find motivation, and her art seems to lose its vibrancy. 4. Post-traumatic stress disorder, PTSD. PTSD is a mental health condition that can develop after experiencing or witnessing a traumatic event, such as a natural disaster, combat, or physical or sexual assault. Individuals with PTSD may experience intrusive thoughts, nightmares, flashbacks, and intense emotional or physical reactions when reminded of the traumatic event. Example: Alex, a 28-year-old veteran, has been struggling with PTSD since returning from a combat deployment. He often experiences vivid nightmares and flashbacks, reliving the traumatic events he witnessed during his service. Loud noises or unexpected situations can trigger intense anxiety and panic attacks, making it difficult for him to engage in social situations or maintain stable employment. 5. Eating disorders. Eating disorders are serious mental health conditions characterized by disrupted eating patterns and unhealthy attitudes toward food, weight, and body image. Common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Example: Sophia, a 19-year-old college student, has been struggling with anorexia nervosa. She has an intense fear of gaining weight and a distorted body image, leading her to severely restrict her food intake and engage in excessive exercise. Despite being underweight, Sophia still perceives herself as overweight and continues to pursue unhealthy weight loss practices. Substance use disorders. Substance use disorders involve the problematic use of alcohol, drugs, or other substances, leading to significant impairment in an individual's daily functioning and well-being. These disorders can range from mild to severe and can have a profound impact on an individual's physical and mental health, relationships, and overall quality of life. Example: Michael, a 45-year-old software engineer, has been struggling with alcohol use disorder for several years. He finds himself unable to control his drinking, often consuming excessive amounts of alcohol despite negative consequences, such as missed work, strained relationships, and legal issues. Michael's dependence on alcohol has led to various health problems, including liver damage and depression. Obsessive compulsive disorder, OCD. OCD is a mental health condition characterized by intrusive thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, that an individual feels compelled to perform to alleviate anxiety or distress. Example: Sarah, a 32-year-old teacher, has been living with OCD for several years. She experiences intrusive thoughts about germs and contamination, leading her to engage in excessive hand-washing and cleaning rituals. These compulsions can consume hours of her day and significantly impact her daily routine and ability to function optimally. 8. Attention Deficit Hyperactivity Disorder, ADHD. ADHD is a neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity that can interfere with daily functioning and academic or occupational performance. Example: Tyler, a 10-year-old student, has been diagnosed with ADHD. He often struggles to stay focused and attentive in class, frequently fidgeting or becoming distracted by minor stimuli. Tyler's impulsivity can lead to interrupting others or acting without considering consequences. Despite his intelligence, his ADHD symptoms make it challenging for him to complete tasks and achieve his full potential. 9. Schizophrenia. Schizophrenia is a chronic and severe mental health disorder characterized by distortions in thought processes, perception, and emotional responsiveness. Individuals with schizophrenia may experience hallucinations, delusions, disorganized speech and behavior, and difficulty with cognitive functions. Example: Emma, a 28-year-old woman, has been diagnosed with schizophrenia. She experiences auditory hallucinations, hearing voices that are not present, and has difficulty distinguishing reality from her delusional beliefs. Emma's symptoms can make it challenging for her to maintain relationships, hold employment, and engage in daily activities without support and proper treatment. 10. Autism Spectrum Disorder, ASD. ASD is a neurodevelopmental disorder characterized by difficulties with social communication, restricted interests, and repetitive behaviors. Individuals with ASD may experience challenges in understanding social cues, building relationships, and adapting to changes in routines or environments. Example: Jacob, a 12-year-old boy with ASD, struggles with social interactions and communication. He has intense interests in specific topics, such as strains or dinosaurs, and can become fixated on these interests to the exclusion of other activities. Jacob also engages in repetitive behaviors, like rocking or hand flapping, which can be a way for him to self-regulate and cope with sensory input. These examples illustrate the diverse nature of mental health conditions and the ways they can impact individuals' lives. It is important to recognize that mental health exists on a continuum, and seeking professional help and support is crucial for managing and treating these conditions effectively.